Good morning. I'm Michael Cooper, a Member of Parliament for St. Albert, Edmonton, and a member of the Justice Committee. I'm very pleased to be joined this morning by my colleague, Member of Parliament Arnold Viersen, as well as Dr. Andrew Taylor, as well as a number of other physicians who are joining us virtually. Medical assistance in dying is one of the most complex areas in which Parliament can legislate. And it is on that basis that it is deeply troubling that this government is proceeding to ram through legislation that will radically change Canada's medical assistance in dying regime without appropriate consultation with experts, including physicians. When the Supreme Court of Canada, in the Carter decision, struck down the blanket criminal code prohibition on medical assistance in dying, the Supreme Court contemplated a carefully designed and monitored system of safeguards. There are significant concerns that Bill C-7 will eviscerate key safeguards that were passed by Parliament a short 4.5 years ago. It is why every national disabilities rights organization opposes Bill C-7. It's why the Special Rapporteur on the Rights of Persons with Disabilities has expressed concern about Canada's medical assistance in dying regime. It's why more than 900 physicians have penned a letter expressing their opposition to Bill C-7, including the distinguished physicians who join us today. These physicians sought to provide their input and expertise to the Justice Committee as we study Bill C-7. And in good faith, they submitted briefs to the committee, or attempted to submit briefs. But when they submitted those briefs, they were rejected. Their voices, as a result, were silenced. And members of the committee, including myself and others who were working to study the bill, were denied an opportunity to hear their perspectives on this bill as we consider important amendments to the legislation. Why were these briefs denied? Well, very simply because the Liberals arbitrarily imposed a deadline of midnight, November 12th. Unknown to opposition members of the committee, unknown to the physicians who attempted to submit briefs, and unknown to the public. This is completely unacceptable, and it's why today at the Justice Committee I will be bringing forward a motion so that the voices of these physicians can be appropriately heard. And it's imperative that this is remedied because we need to hear the voices of experts. We need to hear from physicians in order to do appropriate due diligence, which this government is not doing as they seek to ram this through. And the fact that these briefs were rejected just underscores the degree to which this government, in a very reckless manner, is proceeding with this legislation. So with that, I will now turn it over to Dr. Andrew Taylor, who will introduce the physicians who join us today who were silenced by the Liberals.
Thank you very much. So my name is Andrew Taylor. I should state that my views are my own and don't represent any institution or hospital I've been associated with in the past. So I'm joined today by other physicians who have had their briefs rejected by the Justice Committee. I'm adding my voice of concern to theirs about how this legislation is being rushed and that key stakeholders are not being properly considered and consulted. Medical professionals have the most direct contact with the most vulnerable in Canada. Our lived experience with our patients offers a wealth of experience that should be drawn upon to inform laws that govern the medical profession and the care their patients receive. As an emergency and family doctor, I know the importance of consultation, along with the day-to-day experiences and sufferings of Canadians, which cannot be ignored. I'm terrifically concerned about this bill. I worry about the vulnerable individual coming into the emerge that is offered same-day MAID, or there is no second witness. I'm terribly concerned about this, and I don't think these concerns can be ignored by the Justice Committee. So I now turn it over to the physicians.
Thank you, Dr. Taylor. My name is Dr. Stephanie Kafie. I'm a family physician with a focused practice as a patient in care of the elderly. I work in a hospital and also in retirement homes with some of the most frail and vulnerable members of our society. More than 900 Canadian physicians have signed a petition raising concerns about Bill C7 and its lack of safeguards for the most vulnerable members of our society. While this misguided bill has been rushed through Parliament and committee, legislators have not taken the time to address the state of palliative care in our country. Palliative care is currently not an essential service under the Canada Health Act, but medical assistance in dying is considered an essential service. In my clinical experience, many requests for MAID actually requested a need for good quality palliative care, and providing that care to the patient actually changed their request for MAID and changed their decisions. Despite firsthand experience in the field, we are not being adequately consulted on these drastic changes made in this legislation. Thank you for your time.
My name is Drijber. I've been a family physician for over 25 years, serving in palliative care and working as a medical director of a long-term care center, among my other responsibilities. In my experience, when a patient inquires about MAID, when I ask questions about their motivation and address those concerns, they often change their minds. I find it concerning that this legislation seems to ignore the importance and dignity of the patient that flows from quality family medicine and palliative care. It seems that the Justice Committee has not fully consulted the experts or people who work in the field to guide them in their decision-making. My concern comes from my observation that the disabled are often made to feel that their life is not worthy of living, or that they are a burden to their family, their society, or both. Disability groups and those who practice family medicine and palliative care are important stakeholders in the discussion of this legislation, and their voices must be heard.
I am Dr. Jane Dobson, and I'm a family doctor working in long-term care. This bill has introduced many alarming changes to MAID, medical assistance in dying, by removing vital safeguards while not giving enough time to fix many of its problems. My disabled patients already feel disempowered and looked down upon by society, and this bill reinforces these issues, implying that their lives are not worth living or saving. This legislation works towards suicide assistance rather than suicide prevention for the disabled and chronically ill. Changes need to be made to this bill. It should strive to find alternatives to suicide and apply the standard of medical and psychiatric care that all Canadians deserve. It should have safeguards to protect the most vulnerable in our society. But the deadline set for this legislation is unreasonable and has left little time for changes and for proper consultation of affected groups. Please make changes to this bill by introducing the needed amendments. Thank you.
I am Dr. Geoffrey Purdell-Lewis from Dundas, Ontario, and I am concerned with the Justice Committee and the government's failures to properly consult medical professionals and other knowledgeable parties involved in the care of vulnerable Canadians. Several of the changes proposed in Bill C7 fail to adequately address important questions. As we gain more understanding and develop medical technologies, there could be new effective treatments or medications or other changes in a patient which could lead them to decide that life was not so bad after all. I would recommend 2 independent witnesses to help each witness keep honest and that the proper expertise is applied. Likewise, Bill C7 deals with mental health questions and challenges, along with a large number of other difficulties requiring greater consultation. Moreover, once introduced, there is no going back with same-day death. Ultimately, this legislation misses the mark, and the failure to properly consult knowledgeable stakeholders will endanger the lives of vulnerable Canadians.
We'll now start the question period. Nous allons maintenant commencer la période de questions. As usual, one question, one follow-up. We'll start with 3 questions on the phone before turning to the room. And please identify yourself before asking your question.
Thank you. Merci. Please press star 1 at this time. If you have a question, veuillez appuyer sur étoile 1 maintenant pour poser une question. There will be a brief pause while participants register. Il y aura un cours de livre permettant de vous enregistrer. We thank you for your patience. Our first question, the première question, is from Ashley Burke with CBC National News. Please go ahead. À vous la parole.
Good morning, Mr. Cooper. Aaron O'Toole this week was very clear when he said that he had a high ethical bar when it comes to his hiring practices. You're employing K.R. Poilievre's wife in your office. Do you plan on changing that in light of Mr. O'Toole's comments this week?
No, I don't. Anita Poilievre has worked in my office for 5 years. She has worked on Parliament Hill for more than 10. She has done exemplary work in my office, and it's fully within the rules.
I understand it's fully within the rules.
It's fully within the rules, and I'm very proud that she's part of my team.
Today, the Board of Internal Economy is expected to discuss who MPs can or cannot hire, and Mr. O'Toole has talked about how he wants the party to be above that. Do you think there's any issue with, as you mentioned, employing other colleagues' spouses?
Well, I think what is an issue is when a Liberal member of Parliament violates the rules, covers it up, and lies about it. That's the issue, not following the rules. I am following the rules, and Anna Poilievre is a distinguished member of my staff who's done tremendous work, and I'm proud that she's part of my team.
Thank you. Merci. Once again, please press star 1 if you have a question. Veuillez appuyer sur étoile 1 si vous avez une question. We have no further questions registered on phone line. I would now like to turn it back over to the room.
Hi, David Thurton, CBC News. I'm interested from hearing maybe from the doctors or even you, the MPs. This legislation, this amendment to the legislation is very important for people who haven't been able to access MAID. So let's just say you get the opportunity to present the points of view that you feel are being signed. So what amendments would you say? What are the compromises that you would offer so that the people that truly really want to access MAID can get access to that, but at the same time, the vulnerable people that you're speaking about aren't pressured into dying?
Well, thank you for your question. And what we as Conservatives have put forward are a series of amendments to ensure that vulnerable persons are protected. One of the things that is troubling about this bill is it removes safeguards that 4.5 years ago were really not controversial. Indeed, there was considerable consensus around a reflection period. This legislation would open the door to same-day death, a safeguard to simply require that there be 2 witnesses. When someone executes a will, 2 witnesses are required, but yet this legislation would remove that. And so what we are putting forward are, I think, reasonable amendments to address some of the concerns that have been expressed by a wide number of stakeholders as we try to balance, on the one hand, respecting individual autonomy, while at the same time recognizing that we need to protect the rights of vulnerable persons. That is precisely what the Supreme Court called upon Parliament to do, and I have serious concerns that this legislation is a significant departure of striking that balance.
And doctors.
Out of my pay grade right now. But as to what I'm seeing with these amendments that are being presented, the same day death, no contemporaneous consent, and not having a second witness, it seems, I don't think this is expanding it. There is access to MAID already, and in the hospital I work in, that exists. But this opens it up to, say, a vulnerable individual, somebody who comes in with a hypoactive delirium, somebody whose mind is not quite there and asks for this. They can get MAID that same day, and that might not actually be something they want. It's a very hard thing to assess. So I think you actually need that waiting period. It's quite shocking that this is even being put forward. I think there's going to be families who are going to be upset that their loved one went into the hospital and died the same day. So I'm terribly worried about this.
If I can add just a little bit as well. This bill creates two classes of Canadians. The Prime Minister said a Canadian is a Canadian is a Canadian, and this bill is making it so that if you are a able-bodied Canadian that that is attempting suicide or seeking to be euthanized, you are then therefore granted all of the suicide prevention measures that this country has to offer. If you are a disabled Canadian and you are requesting MAID, just because of the fact that you are a disabled Canadian, you are then eligible for MAID. The disabled community is very much concerned that there's two classes of citizens, one class where suicide prevention is widely available to, and the other class is on the first moment that they request MAID, there will be no attempts to dissuade them of that. Thank you.
Whoop.
Drijber here.
Sorry, maybe someone wanted to chime in. No. On the.
It's Dr. Drijber here.
Yeah, go ahead, doctor.
I would echo the last speaker's sentiments. I think we in Canada have to arm ourselves against the dual problem of ageism, which says those that are elderly are not worthy, and ableism, that says those that are not able are not worthy. That is very real. It is systemic, just as racism is. It needs to be addressed. This bill reinforces it, doesn't help it.
But the thing I'm not is that there are people that want to access this procedure who are concerned that they will not be lucid enough, or their illness will put them in a position that they won't be able to express their wishes. And from what I understand, this legislation, the amendment hopes to address that. So how do you respond to those people that are saying that I don't want to be in a position with a terminal illness where I won't be able to access this, and so I need this amendment that allows me to give my consent ahead of time?
I understand your question. I think you're speaking specifically to the 10-day reflection period and individuals who suggest that somehow they could be incapacitated within that period of time. Let me just say that C-14 already contemplated such a circumstance. The real problem with this legislation is it is a purported response to the Truchon decision, which was a Quebec lower court decision, one judge in one province. Really, what the Attorney General should have done is appealed the decision to provide clarity and to provide Parliament time to address any changes to the medical assistance in dying regime. The government didn't do that. As a result, we are in this, I think, unacceptable situation where we are dealing with very complicated legislation that goes well beyond the parameters of Truchon in a rushed timeline without adequate consultation. And that should alarm all Canadians when we're talking about something in which the consequences are irreversible. And I think it's why we're hearing so much alarm from a wide range of stakeholders. And what we're simply calling on the government to do is to listen, to consult, to let the voices of experts be heard, to let the voices of physicians who tried to submit briefs have those submissions put forward. Instead, what we have is a government that doesn't seem to want to listen. Instead, it seems to want to muzzle experts and physicians.
Please.
Mike Blanchfield, Canadian Press. This is a question for Dr. Taylor. Perhaps you could flesh out a little bit more on some of the safeguards that you would like to see. I mean, I know you said a moment ago you want to talk about specific amendments. That's not your job, but you're a doctor. You see the situation up close. Can you give some specific advice on some points that you want to see fleshed out in this bill to make it more suitable to the way you want it to be?
Yeah, sure. Thank you. I would say I can't propose any amendments, but the safeguards that there are right now, I think should be kept. With regards to, I mean, the idea that there is a waiting period between the initial asking period, the current safeguards that are being that are considered to be removed, I think they're very good ones, and they were considered essential just a few years ago, and now we're considering removing them. And to my mind, I don't think there is a difficulty in accessing MAID. There's a difficulty in accessing palliative care. If anything, that's something we should be focusing on a whole lot more. I mean, there's a dearth of palliative care, and so I can't say anything to the amendments, but what we have now, I think, should be kept.
Would you say to a patient that wanted you to perform an assisted death based on the legislation that's in place right now, what would you do as a doctor?
So I work in the emergency room primarily. So that's an issue that oftentimes doesn't come in. It's usually dealt with up on the board. So I can't speak to that, but I could see this, if this goes through, people would want to get that ball rolling that same day, and that'd be problematic. So right now, with current legislation, it happens on the inpatient ward. It doesn't happen for me in the emergency department.
Follow up to Mr. Cooper. Can you elaborate on some more specific amendments? I mean, you said you've tabled them. Perhaps we'll see them later. But can you just outline kind of the top points that you're making beyond the same day issue?
Certainly, we put forward amendments around maintaining a reflection period, given that we know from the data that was before the Quebec court in the Truchon decision that many Canadians change their minds. So that reflection period is essential. We have introduced an amendment to keep the requirement that there be two witnesses. In terms of the two-track process, where death is not reasonably foreseeable, the government has provided a 90-day reflection period. That is completely inadequate, having regard for the evidence that we had heard that to get a palliative care or other supports, the wait time can be significantly longer than the 90-day period. So we have put forward an amendment to extend that period. And we have also put forward an amendment to protect or better protect the conscience rights of medical practitioners, among other amendments.
What is it about the conscience rights that you're seeking to target with the amendment? Can you elaborate on that?
Well, very simply, we have seen that physicians have in certain provinces, particularly in the province of Ontario and Nova Scotia, been subjected to an effective referral regime. We don't think that that is appropriate, that medical practitioners who do not want to participate, should not have to participate, having regard for their charter rights, including freedom of religion. So we put forward, I think, a reasonable amendment that would protect the conscience rights of physicians while ensuring that patients who do seek to have medical assistance in dying and who do qualify would be able to get the access.
To move this forward?
Well, I think what we need to do right now is we need to hear more evidence. I mean, one of the things that has been so frustrating about this is we've had 4 meetings in which we've rushed through witnesses. Often there's only been 1 round of questioning per panel for each of the parties. And so to be able to get the kind of information to deal with what is a very complex piece of legislation that I stress goes well beyond the Truchon decision is problematic. And I say that having some experience in this area because I served as the vice chair of the Special Joint Committee on Physician-Assisted Dying. I sat on the Justice Committee when we studied Bill C-14. There were flaws with those processes, but nothing in comparison to this where we really have just seen a government that wants to ram through this legislation in the face of significant objections from many key stakeholders, including the voices you heard today.
Operator, any further questions on the phone?
Once again, please press star 1 if you have a question. Veuillez appuyer sur étoile 1 si vous avez une question. We have no further questions on the phone.
Right, thank you.
This concludes the press conference. Thank you.